Hey everybody. In this video we're going to be looking at a few basic anatomy concepts, talking about some directional terms, talking about anatomical position, talking about planes. It's just kind of a foundational video so that when we're talking about structures' relationships to one another, or we're talking about what plane something lies in, you have some idea of what we are talking about. So this first concept is a simple one. It's called anatomical position. And that is really easy to explain because the skeleton is in anatomical position. So his palms are facing forward, thumbs are facing out, the radius is lateral to the ulna. It isn't crossed over the ulna like it would be if you were just standing comfortably with maybe your thumbs facing forward with your palms on the lateral aspect of your thigh. It's a specific position. And when you are referencing a structure being superior, inferior, medial, or lateral, you're going to be referencing it in anatomical position. So if that doesn't make sense now, hopefully it will make more sense as we move forward. The first pair of anatomical terms we'll be discussing are superior and inferior. This may not be the most scientific way to put it, but superior basically means up or above, and inferior basically means down or below. I think the easiest way to explain these terms is to use an example. So let's take a look at the L4 vertebra. The L4 vertebra is inferior to the L3 vertebra. The L4 vertebra is superior to the L5 vertebra. The humerus is superior to the ulna, although there's even a better term for that. Your 12th rib is inferior to your 11th rib. Pretty straightforward. When you're thinking about structures, try to think of their relationship to other structures using these terms. The next pair of anatomical directional terms we're going to talk about is medial and lateral. So medial means towards midline. If you think of a freeway median being in the midline of the freeway, medial means towards that median. So here's the body's median, so to speak. So if we look at the radius, we would say that the radius is lateral, away from midline, compared to the ulna. The ulna is medial to the radius because it's closer to midline. So let's look at these two structures here. They group them together, but actually these are two different structures. One is called the capitulum, one is called the trochlea. Another name for these two structures is medial and lateral condyle. The trochlea is medial to the capitulum. The capitulum is lateral to the trochlea. So another name for these would be medial condyle. The trochlea is called the medial condyle, and the capitulum is called the lateral condyle. Just an example of medial and lateral. The next pair of terms is proximal and distal. So I think the best way to think of this is proximal is towards sort of the center mass of your body, and distal is away. And this is particularly useful in the limbs. We can say something like the radius is, we can say the radius is distal to the humerus. The humerus is proximal to the radius, or proximal to the ulna. One more set of terms, there are more, but these are the ones we're going to be using the most. So one more set of terms is anterior and posterior. You may see ventral used. It means the same thing as anterior. And you may see dorsal used, which means the same as posterior. These are terms that really are more applicable to animal anatomy, more so than human anatomy. In an animal being down on all fours, ventral would mean, the stomach side of the animal, the front, or the side rather that's facing the ground. and dorsal would mean the top. So if you picture a shark has a dorsal fin on its back. In the human skeleton, or just in human anatomy period, anatomical position, we're not down on all fours, we're standing up. Anterior and posterior make more sense in that case, but you will see both used. So anterior, posterior. Let's look at the skull. The frontal bone is anterior to the parietal bone. The body of the sternum is anterior to, well, just about everything, but to the ribs. Let's go ahead and look at the anatomical planes. These are really, it's conceptual, so it's talking about, if you guys remember from geometry, that there are planes. This is not a functional thing necessarily. It's not an anatomical structure. It's a construct. It's an idea. It makes more sense when we get to joints and movement, because we can talk about limbs moving in planes. But it is good to cover now because certain structures are named after these planes because they're close to line in that same plane. So let's quickly look at this, and I'll try to make as much sense as possible. So let's look from a lateral view, try to get as lateral as possible here. And let's draw a line. Oops, I didn't mean to make that curve, but this is a little squigglier than I would have liked, but this is representing the frontal plane or the coronal plane. It's a plane that divides the body into a front or an anterior and a posterior segment. We have a structure here called the coronal suture. Now I neglected to say this, but another name for the frontal plane is actually coronal plane. And this name is called the coronal suture because it's in the coronal plane. It's approximately in a plane. Wow, I'm struggling here. It is approximately in a plane that divides the body into an anterior and a posterior component. We could look at that from a superior view as well. Maybe. Maybe not. It's good as any, I suppose. If you picture a plane dividing the body into a front and a back, or an anterior and a posterior component, that would be the frontal plane. A lot of times it's drawn in textbooks almost like a sheet of glass. It's kind of a good way to visualize this plane of glass going through the body, dividing it into a front and a back, an anterior and a posterior. The next plane is the sagittal plane. Sagittal plane divides the body into a left and a right component. Now, if it's right on the median of the body, it's technically called a mid-sagittal plane, but a sagittal plane can be here, it can be here, or it can be here. The point is that it's dividing the body into a left and a right component. That's a sagittal plane. Oops. Again, like that. Now, just like we had a suture in the coronal plane in the skull, we have a suture in the sagittal plane. So this suture is in the sagittal plane, more or less. It's called the sagittal suture. And then lastly, we have the transverse plane. And again, it doesn't necessarily have to be exactly halfway, but a transverse plane divides the body into a superior and inferior component. If you think of a cross section of something, like a cross section of a spinal cord, that is a section taken in the transverse plane. So these are all transverse planes. No transverse suture of the skull, unfortunately, to show you an example. But anyway, that is it, guys. So we've covered anatomical position. We've covered 3 pairs of directional terms: superior, inferior, medial, lateral, proximal, distal. Oh, actually, I'm sorry, 4, an anterior, posterior. And we covered 3 anatomical planes. Thanks, guys.